When it comes to the argument nature versus nurture in ADHD, this can include environmental toxins like drug or alcohol use during pregnancy, which is environmental, or it can be, lead in the paint that was, in the home or any pipes or something like that, versus it being hereditary factors like blood relatives or parents or grandparents or, anyone in the family, like I said before, who may have had mental issues, other mental issues, or even ADHD themselves. There are two main treatments for ADHD. Now, like I said, it's not curable, but it is something that is manageable. And depending on what your parents think are best at a young age or what you might think is best when you become a teenager or an adult, depends on the treatment type that you might go with. There's medicine, and that can be prescribed through one of the psychologists, neurologists, or psychiatrists. And there's also behavior therapy, where you can go and speak to somebody weekly, even sometimes monthly, about your behavior or what's going on or how your mental state is. Or sometimes there can be a combination of both medicine and behavior therapy. It kind of just depends on what works well with you. Now, there are also alternative methods for those parents or people who don't believe in using medication or, who don't believe in talking to someone. There are elimination diets, there's supplements, omega-3 that they can take more of that helps when it comes to behavioral issues. There's also parenting training that parents can go to make sure that when it comes to their child, they're informed. They know what they can do to help out. They know what they can do not to trigger certain things. And memory training for the children themselves so that when it comes to following a routine or something, they know that this is what needs to be done. They're short, concise rules, easy to follow. And then at the end of that, reward them with something as to where children, they're paying attention to their treatment, but they don't really actually know that it's a treatment from them. Like I said, the long-term treatments through the therapist and titration, is like monthly sessions or trials to get the medication and to get your mental capacity and everything to balance out. To me, psychology is a perfect imbalance of nature versus nurture and genes versus environment, how they both play a part in everyday lives and how everyone's behavior can be affected by ADHD. This course has made me more conscious of how prevalent mental health issues are and how someone you may not even notice as to how they're dealing with them. You might think that people are okay and you don't really know what they're struggling with on the inside. It's made me more aware, pay attention to my friends, my family, coworkers, and just associates that I have. That way, if I see something or, I could be someone they can talk to. Going forward in my careers and my jobs and pursuing what I want to do in healthcare administration, I know that when it comes to being in contact with people constantly, that it helps just to be a little aware of things outside of my realm. Psychology has taught me that your behaviors are affected by chemical imbalances that you may have, and that it's not always something that shows signs